Okay, hello everyone. So this week we are doing hematology. So I am going to present this case study and hopefully this recording and everything works. All right, so patient comes in to see you. She reports she's just has not been feeling like herself. She's been feeling very, very tired, increased irritability, probably for about the past 6 months or so. She's really noticed an increase. She generally is a very active person, um, usually very physically active, goes for a hike almost every day, at least 2 miles. Goes for bike rides, just as and generally in general has very good energy. Um, but over the past 6 months or so, she's noticed just a decline in her energy. Um, that has increased her feelings of she's been a bit depressed, but she's not sure if that's because she doesn't have energy or if she's not able to get her exercise. So that's affecting her depression. Um, She also reports some changes in her gut. She says she's been feeling a little bit more constipated, tends to skip days sometimes between bowel movements, which isn't very usual for her. She reports she eats a very healthy diet. She says that a few years ago she decided to start eating mostly a plant-based diet. At this point, she's been pretty strict for, a couple years now, no animal products, but lots of whole grains and fresh fruits and veggies, um, and feels that she has a pretty balanced diet. So she's not sure the change, but in the past about 6 months or so. So when you do your review systems, the patient is quite fatigued looking, tall, thin, 37-year-old African-American, cisgendered female. She reports generalized fatigue, increased lability with mood changes from depression to irritability. She hasn't had any changes in her sleep. She um, does report, though, the increased fatigue has been making her nap during the day when she can. Um, this is very concerning to her because she's not been able to keep up with her daily physical activity. She's concerned that she's been experiencing constipation more often, um, even though she has not changed her diet, eats plenty of um, vegetables due to her plant-based diet. She has recently started drinking some green tea for caffeine to help her throughout the day. Her past medical history is significant. She did have dysmenorrhea um, with painful periods, lots of cramping, some irritability, but that seemed to resolve in her early 30s. She says that really hasn't been as significant for the past handful of years. So she reports currently her menses are regular. They last for about 3 to 5 days, mild bleeding. Um, she doesn't have any chronic health issues. She's never needed any prescription medications. She does use some over the counter medications occasionally, such as NSAIDs, especially when she had dysmenorrhea. Um, or if she pulls a muscle when she's hiking, she'll use some NSAIDs. And she uses Tums sometimes because she does get occasional heartburn, mostly food related. So just occasional Tums. Um, she denies any allergies of medications or foods. Um, she does have some seasonal allergies during the spring, but she um, doesn't really have to take any medications for that generally. And she denies history of depression or any other mental illnesses. So this depression is somewhat new that she's been experiencing. Family history is significant for her older brother has sickle cell anemia. He was diagnosed as a child, but his symptoms have been mild and he does not require extensive medical management at all. Um, Her mother has a history of thyroid issues. She thinks she had low thyroid. She's not quite sure. Her father has a history of alcoholism, but has been in recovery for the past few years. Other than that, that's all she reports. So on physical examination, normal temperature, normal blood pressure, 115/75 sitting. Her heart rate is 95, regular rhythm, respiratory rate 16, BMI 18. Her skin is cool and dry to touch. There is conjunctival pallor bilaterally. In her mouth, her throat looks normal color, no swellings, no exudate. Her tongue is slightly red and a little bit glossy. Her cardiovascular exam was normal, normal heart rate rhythm, normal blood pressure, respiratory exam normal, no issues with lung sounds, no difficulty breathing, no shortness of breath. Well, she did report shortness of breath sometimes when she is walking. When she is able to go on her daily walk, she does feel like she has a little bit of shortness of breath once in a while, along with that fatigue. So her abdomen is slightly tender to palpation. There is a bit of stool present in the large intestine, but bowel sounds are normal and present in all quadrants. Neurological exam, totally normal, nothing off with that. So there were some labs that she had drawn. So she had a CBC. This is what it shows. Her hematocrit and her hemoglobin were both a little bit low, sort of borderline, 33% for the hematocrit, 11 for the hemoglobin. Her MCH is 33.1, so just very slightly elevated. And then MCHC is normal, 33.9. Mean corpuscular volume is a little bit high, so 107. And her platelet count is normal at 250. Her red blood cell count is a little bit high at 5.5. RWD 13.9%, that's normal. White blood cells 3.9, so slightly low, but really borderline. She also had an iron study and a B12 and folate. Her iron was 77, so it was normal. Her TIBC was 307, so that was normal, her iron binding capacity. Her ferritin was a little bit low at 15, and her folate was 10.2, so that is within the normal range. And her B12 was 198, so that was a little bit on the low side. So these are all the labs that she had drawn. And so this is the information we have. So for discussion, some things to think about with her case. What are some of the differential diagnoses that this patient may be experiencing? What may be some of the contributing factors to her symptoms? What characteristics of the patient might contribute to her disease process? This is where we would think age, weight, heritage, that sort of thing, ethnicity. What are some lab tests that you might want to order? So based on some of the other differential diagnoses that might be possible, what are some other tests that might give us a little more clarity into what's going on, and either confirm or rule out diagnosis? And lifestyle, what are some possible contributing factors to her symptoms as far as her lifestyle? So I hope this is an interesting process, and I look forward to the discussion. All right, I hope you all have a great day.